My name is Dr. Jane Crowe and I'm a GP. For many men with prostate cancer, the path to diagnosis and treatment starts with a GP, when the conversation about prostate cancer testing takes place. For a man who has no symptoms suggestive of prostate cancer, current Australian guidelines recommend a man be informed about the benefits and harms of testing. This is so the man can then weigh up whether or not to proceed. This is called shared decision making, and advice is tailored depending on your age, the rest of your general health, and whether or not you have a family history of prostate, breast, ovarian or bowel cancer. However, for some men, prostate cancer is diagnosed after they present with symptoms that may be suggestive of prostate cancer. If you decide to be tested for prostate cancer, the first step is to have a blood test to check the level of PSA in your blood. PSA stands for prostate-specific antigen and is a protein made by the prostate cells that also enters the bloodstream. If the PSA test comes back elevated, it suggests something might be going on in the prostate that needs sorting out. It could be infection, inflammation, benign enlargement of the prostate, or it could be prostate cancer. Your GP will arrange a referral for you to see a urologist. And when you do see the urologist is likely to examine the prostate via a digital rectal examination, and you may also be required to have an MRI to image the prostate. The urologist will then use the combined information of your PSA, the digital rectal examination, and the MRI to decide if you will need to have a biopsy of the prostate. The biopsy is when a sample of the prostate is taken by inserting needles into the prostate. The result of the biopsy will determine if there's cancer in the prostate or not. If cancer is found, there are two broad groups. The first group is if a small amount of very low-grade or low-risk cancer is found on biopsy. In this case, you may be advised not to have the prostate treated, as it is very unlikely to spread or cause you any problems. However, you will need to be monitored closely by a specialist by a process called active surveillance, just in case a higher risk cancer is found or develops. The second group is if you have a biopsy and a higher grade cancer is found and treatment is required. For most men, the treatments are surgery or radiation. And the Australian guidelines recommend you get two opinions, one from a surgeon and one from a radiation oncologist. This is so you can weigh up the pros and cons of both treatments before proceeding down the treatment path. Your GP can help discuss these treatments and provide referrals. If you would like even a second or third opinion, that is perfectly fine and your GP can help to arrange this. A recent study in the British Medical Journal reported that continuity of care is associated with multiple benefits for patients. Continuity of care and holistic care underpin what GPs do. Your cancer specialists regularly update and communicate with your GP, and your GP is part of your cancer treatment team and can be there for you along the entire treatment path. If you have prostate cancer, here are some examples of where your GP could help you. In cases where localised prostate cancer has been treated at some hospitals, you might have some of your follow-up appointments shared between the hospital and your GP, and this is called shared care. And the hospital cancer treatment team communicates clearly with your GP about what is required. Also, if you have localised prostate cancer that has been treated, some hospitals will discharge you back to your GP after a period of time for ongoing follow-up. Again, the GP will know what to do. In other areas, your GP can provide ongoing support and education of what is going on with your treatment and discuss treatment options with you as they occur. Your GP might administer some of the injections if you are on the androgen deprivation or hormone therapy. Your GP can be a first port of call for any concerns, side effects or psychological distress, and can give advice regarding the impact of the diagnosis and treatment on you and your family members. They can work through problems or any concerns relating to work, accessing appointments and treatments, and so on. Your GP can also assist with referral to allied health practitioners, for example, continence physiotherapists, exercise physiologists, psychologists, and they can also help to arrange GP management plans, team care arrangements, or mental health care plans. These are so you can access Medicare rebates for allied health and psychological counselling if required. Your GP can also help to liaise and coordinate your care with all your other treating health professionals, just like a hub in a wheel. Your GP can also help you to link into the local community resources and services, and also give some reliable online websites for further information and support. Importantly, the GP can keep an eye on the rest of your health, for example, immunisations, blood pressure, cardiovascular health, and other non-cancer related health conditions that may affect you.